they don't have enough training to practice on their own, and that puts patient safety on the line.
Every single day for the past 4.5 months, Sonny Nguyen and his wife Lynn Lam take familiar steps to a hospital room to see their oldest child, knowing she will likely never look back at them.
You're okay. Mama's right here, okay? I'm right here. Mama's right here. You're okay.
18-year-old Emma Lynn will never see the family photos on the wall or the words of encouragement that seek a miracle.
So we're hoping that she does hear us, that she recognizes our voice. So that's what we're hoping. We try to believe that she can hear us, but we just don't know.
The room with the feeding tube and the oxygen machine is Emma Lynn's entire world for as long as she may live. It wasn't supposed to be this way.
I wasn't able to go back there to check up on her, but she's still doing fine. She's young. Maybe that's the reason why she's taking longer to wake up.
You don't let my daughter sit there because you thought she's gonna wake up.
Emma Lynn never did wake up. An MRI shows permanent brain damage. Her heart works, but only with artificial help.
Our body is still there, but she's not there. So we feel like we lost a daughter.
I just want to find out the truth, what happened, and prevent this from happening to other people.
Emma Lynn wasn't monitored for 15 minutes. She now faces a lifetime of emptiness.
She will remain in a nursing home, essentially non-functional, with someone feeding her through a tube for the next 50 years.
We thought that's going to be easier every day, but it doesn't. It's really hard to see her this way.
Especially when her parents look at old photos. This framed photo gallery shows her progression each year, from a little girl to a teenager to her senior photo, never predicting a few months later her aspirations would end on a surgical table.
I feel like she have no future left.
She always wanted to go travel the world, you know, live life to the fullest and have fun. So I would never want this to happen to anybody. It's a horrible feeling to watch your child suffer.
This is a family on a mission, seeking justice for their father and husband.
We feel like my kids and I that we're standing up for my husband. We're fighting for my husband. If any good can come out of this, I want to try to make a change and make sure it doesn't happen to anybody else.
Stacy Gilbo lost her husband of 20 years in February 2017.
He was fine that morning, had coffee together, left for work, and that was it.
The unexpected death of 47-year-old Brad Gilbo dealt a devastating blow to this close-knit family. Brad was not only a father, but a friend to his son Jacob, a student at Texas A&M University.
Me and him were really close, just about my best friend. Called him more than I called mom, kind of thing. He was a really good dad. A little strict on me sometimes, but he was a really good dad.
Jacob's 14-year-old sister Gracie says when her dad died, she lost her biggest supporter.
He was so loving, and I was definitely a daddy's girl. Everything I did was definitely with him, and just enjoyed being outdoors with him, spending time with him, and sharing laughs.
But for the past year, the family has shared tears.
It's really been difficult, you know. I've had to grow up, become a man, you know, and kind of be a dad, but still be a brotherly figure, and still be a son. But we've been getting through it.
Jacob wears his father's crucifix, and memories of Brad fill the Gilbo's home. But Stacy says the greatest gifts her husband left her were Jacob and Gracie.
He would be very proud, very proud. He worked very hard to provide, to make sure my son could go to A&M, and he would be very shocked at how beautiful my daughter is and what she's done with all these pageants.
Stacy says Brad lived for his wife and children. That's why they're honoring his memory, to spare others the same pain and suffering.
He's missed dearly. We're kind of lost without him. I just want to bring awareness to everyone and make sure no other family has to go through this. I really do believe in my heart that was the cause. He had no other medical issues in the family with heart attacks or heart issues. I do believe it was everything to do with that. He definitely don't like any attention, but I think he'd be proud of us for standing up for him, fighting for him.
Mm-hmm. Full throttle on it. I'm gung-ho about it, and I think it needs to be done to protect other families, because There's no need for people to die.
She absolutely loved music. She loved Yo Gabba Gabba, sing and dance and play. She was learning to ride her bike before she passed away.
Betty Wattenbarger died last year from flu complications. Her family says she was treated by a nurse practitioner at an urgent care in North Texas who didn't have enough training. We shared their warning with you last month. They insist patients see a doctor, especially during this pandemic. It was one of our most talked about investigations. Who should treat you?
Betty Wattenbarger loved learning to ride her bike, but her dad Jeremy says she never got to take the training wheels off.
The joy, the happiness, and all that's gone now.
Betty was just 7 years old. Jeremy says she died in January of 2019 from flu complications caused by pneumonia and sepsis, which is the body's severe response to an infection. This is one of the last photos of her when he took her to pediatric urgent care Denton near Dallas, Fort Worth.
She's, looking very discolored at that point. She's sick. She's running a fever.
She was treated by a nurse practitioner and diagnosed with flu. Her father says no x-rays were taken and no other medical tests were done. The next day, he rushed her to the ER, where she died.
Had a third of a cup of fluid in her left lung. Her other lung had the start of pneumonia.
How was that missed?
That's a lack of training. That's why doctors go to school for so long.
Here we go. 7-year-old Betty was the light of the Wattenbarger family.
We'll get you.
Looky there, you got a rubber ducky from Cece.
Butter, butter, butter.
I actually had taken a snapshot of Betty that day, actually in the waiting room, and sent it to my mother. And I said, "Mom, I'm really worried. Betty doesn't look right." They tell us that Betty was positive for type A flu. Her lungs sound good and clear, and they just sent us on our way.
By the next morning, Betty's condition took a turn for the worse.
She falls down in the shower, and I thought, wow, she seems awful weak right now. I said, something's not quite right, but she does have the flu, because that's what they told us. And I said, well, let's make you really comfortable. I get her favorite pillows, I got her show going, and then I know she's starting to ready to go to sleep. I walk back in here 5 minutes later, Betty's head's hanging off the pillow, and blood's just coming out the side of her mouth.
They rushed her to the nearest hospital emergency room.
And the doctor's looking at me, and he's like, she's modeling, doesn't have a heartbeat, we can't get breath. Jeremy, can we stop? Can we stop? And I had to tell him, you can go ahead, stop, and let her go home, let her go rest. And he did. And
I remember hearing the flat line, and I knew at that moment my daughter was dead, that she was gone. And I didn't understand. I was like, how can this be? How can it happen? Because she was acting normal.
Only after the autopsy came back did they begin to understand what happened.
And what did you find out?
We found out that she had sepsis and streptococcal pneumonia. And so what had happened is the day before, when she went into pediatric urgent care of Denton, when she went in there, that she was actually probably in the beginning stages of sepsis or the middle stages of sepsis, septic shock. She had severe pneumonia and had a third of a cup of fluid in her left lung and the start of pneumonia in her right. All of that should have been diagnosed in the pediatric urgent care of Denton.
They thought they were in good hands.
Did you have any doubts about the care that she was receiving at that point?
No, absolutely not. I believed 100% that they were the experts. They had the credentials, the experience. I believed that she was being seen by someone who had the knowledge to diagnose properly.
Do you think you're being seen by a doctor?
Yes.
Well, no, you can't. If you don't have a doctor on staff, you don't even have a doctor on standby anywhere that we know of. There needs to be, a doctor or someone who is supervising on site, who sees what's going on, knows what's going on. We're not talking about working remote. We're talking about someone's life. And so not having that actual check in place, you're allowing a lot of freedom for somebody who's not really qualified to handle it.
I wouldn't wish this on anybody. I wouldn't wish anybody losing a kid because of poor health care.
In the fall of 2015, Amy and Marlon Dockins' daughter, Alexis, was a 19-year-old sophomore honor student and basketball player on the Redland College basketball team in El Reno, Oklahoma. They thought she was being treated by a doctor.
She introduced herself as an attending physician, as the attending physician. I mean, attending physician to me is a doctor. Towards the end of the visit, oh, she's gonna be okay, we're gonna keep her here for observation.
Just hours later, Alexis was clinging to life. She had been suffering from a pulmonary embolism.
3:02 in the morning, we get a call that your daughter's on her way to OU. And frankly, we don't know if she's gonna make it. So when I got the call, I felt like I was dreaming. Like I just left my daughter. I couldn't believe it. So I jumped in the shower with all my clothes on, and I can't understand what the people just told me.
Alexis died hours later.
I just couldn't believe it. And the whole time when we got the call, I was just thinking maybe they made a mistake or something happened, or maybe she's alive up here. And man, I just kind of lost it. I lost it.
Devastated by her loss, and then again by what they uncovered, that Alexis was not treated by a physician, but by a family nurse practitioner.
I was speechless. I was angry. It just wasn't fair. It wasn't fair.
Sophia Thomas is the president of the AANP.
Doctor doesn't mean physician.
If you don't understand something, or if that's not your practice, don't try to work it. You need experience. They call these doctors for a reason. Like, you have to do residency for so long to be a doctor. Let us know what you're doing. Let us know that you're not a doctor.
And the physician world doesn't own the term doctor.
For the Ochoa-Dockins family, there is no gray area. It's simply a matter of transparency.
I'm not against nurse practitioners in healthcare at all. This is not what this is about. I'm against people practicing outside of their scope.
What troubles me is that patients are, they don't know what's happening. They assume when someone says to you, I'm Dr. Smith or Jones, that that's a physician who's been to at least 11 years of training. And that's not true anymore. We have physician assistants who can obtain a Doctor of Medical Science degree. They can walk into any room in America that's a clinic or a healthcare center and introduce themselves as a doctor. And the patient doesn't know the difference.
They continue to fight as the voice for Betty.
It's destroyed our entire family. We'll never be the same, and we don't want this happening to another family.
You guys are not going to give up this fight.
No.
But people have to realize that there is accountability and there is consequences. Our consequence for our daughter was our daughter's death. That was our consequence. That was our consequence. They have consequences they also need to be held accountable for too.